Hi, my name is Angie Chamberland, and this is my case study presentation for HAP 725, Statistical Process Control, and I'm going to be focusing on the Northern Maine Medical Center in Fort Kent, Maine. The data that I'll be using for this case study comes from the Medicare.gov hospital compared datasets from 2014 to 2019, and I'm going to be looking at 5 specific measurements to see how they compare with their competitors. So the two first observations that I'm looking at are the 30-day death rate from pneumonia patients and 30-day death rate of stroke patients. And so these are two events that we're expecting to see in the Northern Maine population, as well as indicators that show how responsive the hospital might be to these conditions and to patient needs. They're events that are manageable, but do present with many complications if they're not handled correctly. And so we're also looking at 3 measurements related to surgery, such as serious blood clots from surgery or after surgery, bloodstream infection after surgery, and post-operative respiratory failure rates. And these 3 measures come directly from community concerns over the quality of care that they're getting in such a rural area. And in particular, we're looking at hospital-related events that are complications from having surgery at this hospital, as opposed to another hospital that these patients might be able to go to. There are limitations to the data that we're using. There are some missing hospitals from the data sets. For example, there is a competing hospital about an hour and a half away from Northern Maine Medical Center that was not represented in the data, and so we couldn't use it in our comparison. The measurement rates do change from hospital to hospital, so while I did use the quarterly data from the years indicated, some of the reporting seemed to stay stable between quarters, which may be indicative that these hospitals are reporting a little bit less frequently. The observation set that we're using is limited, and so we're looking at 5 measures of quality indicators rather than the full set of complex factors that does go into assessing whether a hospital is producing the same quality of care as its competitors. And then the data from the Medicare.gov data sets is pretty opaque and not specific. And so we're not given too much information about how these measures are recorded, how they're obtained, what they mean in a very thorough way. And they're non-specific, so that we don't know what the patient mix looks like. We don't know, for example, in surgery, we don't know exactly what kind of surgeries are represented, and so that might influence the data in ways that we don't really know about. So Northern Maine Medical Center is in Fort Kent, Maine, at the very tip top of the state. It is a town of 3,919 people, and it's actually one of the bigger towns in the area. So as we see, it's very remote, very rural, and a very small town. Right on the border to Canada. Now we're excluding Canadian hospitals from this comparison, even though a lot of people in this area might be dual citizens. Canada changed its laws some years ago, maybe a decade and a half ago, so that non-residents can no longer take advantage of their hospital system. So we're going to be looking at competitors only on the Maine side for that reason. Even though other Canadian hospitals might be geographically closer. So the competitors that we're looking at are 3 different hospitals that patients in this area are likely to seek care at. Now it looks a little funny because these hospitals are all across the state rather than necessarily close by. The nearest hospital to Northern Maine Medical Center is going to be Cary Medical Center in Caribou. It's about an hour away, in a town with a population of about 7,684 people. This is its nearest competitor, and may be pretty interchangeable with this hospital. The 2 other competitors that we're looking at are hospitals that these patients are likely to be familiar with, because there's only a limited range of services that are provided in these smaller, more rural hospitals. And so patients are going to be familiar with these other two hospitals already because they're already going there for either more complex or more specialized services or testing. I say complex and specialized, and oftentimes it doesn't end up actually being, too complex. There's many routine services that this population does have to travel the 3.5 hours to Bangor for, but they are familiar with this hospital, and so these two hospitals are considered competitors because this population is equally likely to seek services at these other hospitals if they're concerned about the quality of the geographically closer hospitals. And so the other two competitors are going to be Eastern Maine Medical Center in Bangor, Maine, about 3.5 hours away in a town with a population of about 32,000 people. And then Maine Medical Center in Portland is in Maine's biggest city. It's about 5 hours away, and Portland has about 67,000 people. And so these hospitals are viewed as competitors for Northern Maine Medical Center. So when we're looking at our quality indicators, we have upper and lower control limits based on the information from this competitor pool. And as we see for the 30-day pneumonia death rate, Northern Maine Medical Center actually performs pretty well. It is within the control limits, but towards the lower half of that range. And we see that we're staying stable within those limits. Quality indicator 2 is for the 30-day death rate from stroke, and so we see that we are staying within those control limits on this measure as well. For serious blood clots after surgery, Northern Maine Medical Center does stay within those control limits, as well as for the bloodstream infection after surgery. And then respiratory failure after surgery, we are within the control limits, and that we see that there is a marked improvement over time. And so in summary, when we take a look at these 5 measurements that were chosen to reflect the concerns of the community as far as the quality of care that they are receiving, it looks like the Northern Maine Medical Center is performing within the quality control limits based on its competitor pool of other Maine hospitals. So we see that from these indicators, we can expect that we're receiving a pretty equal quality of care for the patients in this area. It would be interesting to take a look at other measures that may either support this view or compete against it as well. And it's would be also interesting to take a look at controlling for the complexity of cases seen at the hospital. Again, this is a hospital that tends to refer out for more complex procedures or tests, and so maybe that is affecting its performance levels and making it appear that it is performing better than it is. And we would like to see what the payer mix is like as well, and see if that has any correlation with what we're seeing as far as performance. And with that, thank you very much, and I hope you enjoyed my presentation.